I'm a grandmother, 79 years old. I'm retired. I like to play golf. I went to see an orthopedic surgeon because I was having a lot of shoulder pain and neck pain. It was moving down my arm.
I noticed a few years before Edith, who is my mother, before she had surgery, she'd actually been dealing with a lot of pain. It aged her a little bit. She was always tired. After sending her to go see an orthopedic surgeon friend of mine who does shoulders, her primary care physician had to order an MRI for her.
And when I went to see the orthopedic surgeon, she looked at both MRIs and she told my son Bradley that I needed to see a spine doctor.
And so that caused great concern for me with my mom, and especially knowing all of the things that lead up to spine surgery and how scary that can be for some people. But over the years in my medical device experience, I've got to know Dr. Anderson, and I knew that I needed to consult him right away and get these films to him almost immediately. So I gave Dr. Anderson the disc of her films and asked him to take a look just as a friend.
Brad put his mom's MRI in my bag while we were operating one day, and at that point I didn't know whose MRI it was. He had asked me just to take a look at it, and so when I looked at it later that evening, I gave him a call and said, "Brad,
who is this that we're actually looking at again?" And I said, "This is in relation to you." And I said, "This is my mom." And he said, "You need to get your mom in to see me right away."
And he told me she was having pain that went up into her right arm, and so I told her I really ought to see her pretty soon if she was interested in seeing me. At that point, he arranged for her to come down to San Antonio, and on exam, I realized that it wasn't just a radiculopathy or pain going into her arm, but it was also a myeloradiculopathy, which is due to the compression on her spinal cord as well as on to the compression on her nerve root in her right arm. So at that point, we talked about surgery.
After what we experienced with my mom's surgery and our experience with Dr. Anderson, I would have no doubt recommending that you go see Dr. Anderson if you have any neck or spine or shoulder pain. That is something you cannot ignore, and if you want to go see a specialist, Dr. Anderson is someone I would definitely say you need to go see.